Hello, my name is Parker Miller, and I will be presenting my poster titled The Black Maternal Health Crisis in the United States, a critical examination of racial disparities in maternal mortality. Each year in the United States, hundreds of women die from pregnancy related causes, and thousands more experience severe complications. Despite medical advances, the United States has the highest maternal mortality rate among high income countries, and the burden falls disproportionately on Black women. In 2023, Black women experienced 50.3 deaths per 100,000 live births, compared to 14.5 for white women. This means Black mothers are more than 3 times as likely to die from pregnancy related causes. Importantly, national reviews have found that over 80% of these deaths are preventable with timely, high quality care. These disparities are not explained by social economic status alone. A college educated Black woman is more likely to die than a white woman with no degree, and a high income Black woman faces risks similar to the poorest white woman. This highlights structural racism, implicit bias, and unequal treatment in healthcare as central drivers of the crisis. Globally, the U.S. remains an outlier, with maternal mortality far higher than peer nations, many of which report fewer than 5 deaths per 100,000 births. Beyond deaths, Black women also experience higher rates of severe maternal morbidity or life threatening complications such as hemorrhage and organ failure. There are initiatives underway. Black Maternal Health Week raises awareness. The proposed Momnibus Act would expand access to midwives and doulas. And the CDC's Hear Her campaign emphasizes listening to women's concerns. Some states are also extending postpartum Medicaid coverage and implementing bias training in hospitals. Still, these measures are only a beginning. Lasting change requires systematic reform and restoring trust within Black communities, where decades of neglect and discrimination have fueled deep mistrust within healthcare. Rebuilding trust means providing culturally competent care, ensuring accountability, and centering the voices of Black mothers. This crisis is a wake up call because most maternal deaths are preventable. By closing the racial gap is not only possible, but necessary. By addressing inequalities and committing to equity in care, we can move forward towards a future where no woman in the United States fears dying to give birth. Thank you.